Welcome to Friday's edition of COVID-19. The World Health Organization says there have been over 200 reported symptoms of long COVID. Now, these include shortness of breath, extreme fatigue, brain fog, as well as cardiac and neurological disorders. We have more on this later on with our panel of experts. Here first are the pandemic updates with our Kwon-soa. Now, so I hear Korea has marked little change from Thursday's numbers.
That's right, Sunny, which means we're ending the work week with another number that's close to 2,000. 1,990 to be exact as of 12 a.m. And that is just 3 cases more than yesterday, but it is a drop in domestic transmissions, but a rise in imported cases. So throughout the week, we've been seeing way above 1,000 infections and also an on-week jump by 286 cases compared to last Friday. This Friday, we are actually also seeing another rise in cases outside the capital region. The proportion here of domestic transmission standing at above 41%. And there are some places where there are especially concerns, such as in the southern part of the nation. If we go over to our map here, 180 cases in Busan and 44 cases on Jeju-do Island. That's a record high in daily cases in these places. And with that, Korea has surpassed 220,000 infections in total. And out of the 25,790 people currently in quarantine or under treatment, there are more than 300 people currently in severe or critical condition, and that number for the 14th straight day at above 300. So with the rise in patients who need intensive care, the government has ordered an administrative order this Friday to make more hospital beds available in the capital region. So 171 additional hospital beds will be set in the next 2 weeks. And let's also get a check on the vaccination front. So we've got now 42.8% of the nation's population who got at least 1 dose and 17.4% that are fully vaccinated. Now, despite some setbacks in vaccine supply, officials continue to stress that it will inoculate at least 36 million people with 1 shot by September. Meanwhile, around 400,000 doses of the U.S.-supplied Janssen vaccine are to arrive this weekend here in Korea. That one, of course, just needing 1 dose for full vaccination.
Right, and so a long weekend to mark Sunday's Liberation Day, I believe, has authorities on high alert.
Right, and that is also why Prime Minister KimMoonKyu appealed to the public this Friday to cooperate in overcoming the 4th wave of the virus, just as the nation has done during the 3rd wave, only that this time it could be more challenging, that is, of course, due to the highly transmissive Delta variant. Here's more.
Infections are hitting record highs following the summer vacation season. Please minimize private gatherings and travel during the 3-day holiday period that begins tomorrow. The long weekend should be a turning point in overcoming this crisis, not making it worse.
Kim stressed that the Delta variant, coupled with traveling, is fueling the spread, calling on people to wear their face masks at all times when indoors as well as outdoors. He also recommended vacationers to get swiftly tested for the virus when returning home and make use of makeshift screening centers at rest areas. Businesses are also being asked to check on their employees on their health conditions after their summer breaks and encourage teleworking. The Prime Minister also reminded that illegal rallies that are planned for the Liberation Day holiday will be stiffly punished, that is, stressing, quote, no freedom or rights can precede the protection of people's safety and lives. Now, over fears of rising cases domestically as well as abroad, the South Korea's foreign ministry, meanwhile, has extended a special advisory against non-essential traveling abroad, so that for an extra month until September 13th. And a quick look at some figures abroad. According to the World Health Organization, in the past week, the highest increases were reported in the U.S., India, Brazil, Iran, and Indonesia. And in the U.S., meanwhile, the FDA authorized booster shots for people with weak immune systems. And the total number across the globe now stands at 206.2 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so I'll see you in a bit. Right now, Korea's recent decision to extend the dosing interval of mRNA vaccines followed news of Moderna's delay in vaccine shipments to Korea for this month. For more, I have our Kim Sung-yeon here in the studio with me. Welcome, Sung-yeon.
Good afternoon.
Now, I believe a local delegation has departed for the U.S. to seek a solution over the delay in shipments of Moderna vaccines.
That's correct, Sunny. So the Korean delegation representatives, they departed for the United States this Friday morning to hold talks with officials from Moderna. The representatives plan to discuss ways of resolving the delayed supply of vaccines from the U.S. firm. Now, the delegation led by Second Vice Health Minister Gov'T will hold a meeting with Moderna at their headquarters on Friday afternoon local time. The government reportedly plans to lodge a protest and secure a promise that there won't be other delays in the future. Earlier this year, the government signed a contract with Moderna to purchase 40 million vaccines for 20 million people. However, in the past 2 months, fewer than 2.5 million doses have arrived here in Korea.
I see. Sung-yeon, what do we know thus far about the cause of the delay?
Well, Sunny, it's mainly due to production issues. Moderna said it's due to problems related to laboratory testing operations among its manufacturing partners outside the U.S., which is affecting not only Korea, but many other markets as well. Here is Korea's health minister with more.
Moderna explained that its vaccine supply issue is a global one and apologized to the Korean delegation. We're promising to do its best to deliver the contracted doses.
A Moderna spokesperson said the company does not have any reserve inventory of vaccines to either speed up delivery or cushion any shortfalls and delays. Chung Eun-young, the head of Korea's vaccine procurement task force, said the supply issue may be linked to a manufacturing process involving Swiss contract drug maker Lonza and a Spain-based company which does bottling work for the Moderna vaccine. The Spanish firm was not specifically named, but contract drug maker Rovi provides fill-and-finish services for Moderna vaccines in markets outside the United States.
I see. So as you mentioned, supply disruptions then are a global dilemma.
That's right. Certainly, so many nations worldwide are having these shortages and delays. And Moderna did say the company and its manufacturing partners are working to alleviate this shortage in all of the countries that have been affected. However, this is not the first time that Moderna has been forced to delay its vaccine shipments. As we know, in April, the firm scaled back deliveries to several countries, including Canada and the UK, which it blamed on a deficit of human and material resources, quote unquote, in its European supply chain. Canada was especially hard hit by the supply disruptions, forcing the Canadian government to stretch their dosing interval to 16 weeks and recommended people to get mix and match vaccines. On Tuesday, however, Moderna said it reached a deal with the Canadian government to build a cutting-edge vaccine manufacturing plant in that country. The new factory will provide Canadians with access to domestically produced mRNA vaccines for respiratory diseases, including COVID-19 and seasonal influenza. The company added it is also intended to be used on an urgent basis to provide the country with direct access to vaccines during health emergencies. Moderna did say it is in discussion with other governments for similar collaborations as well.
Right. Now, Sung-yeon, Moderna already has a fill-and-finish deal with Korea's Samsung Biologics, right?
That's right, Sunny. And many observers are hoping at this point that Moderna vaccines manufactured by Samsung Biologics here in Korea can be distributed here in the country following negotiations. Now, Samsung Biologics is planning to start its pilot production of the end product Moderna vaccine in late August. And following that and a final test run as well, the firm plans to begin mass production at around September. Now, earlier this week, lawmakers from the ruling Democratic Party of Korea said working-level discussions were currently underway with Moderna representatives to allow vaccines produced by Samsung Biologics in Korea to be used here at home. A senior government official said the discussions are going well, and there is high optimism that the country can soon obtain more Moderna doses once Samsung Biologics starts its production of the vaccines.
All right, Sung-yeon, as always, thank you very much for that coverage.
Thank you for having me.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Friday. And while we wait for that to start, let's take a quick look at the inoculation appointment timetable for those aged between 18 and 49 here in the country. Online reservations kicked off this past Monday evening. Today, that is Friday, August 13th. Those whose birth dates end with the number 3 can register for their COVID-19 vaccinations. The briefing is about to start. We'll come back to you afterwards.
We also have members from the Ministry of Health as well as Ministry of Food and Drug Safety. First of all, here is Commissioner of the KDCA with more details. Let us now begin our regular briefing for August 13th. First of all, as for the Pfizer vaccine contract, here are some details. The government has agreed also to secure more COVID-19 vaccines for the year 2022. And we also have agreed to sign a contract today with Pfizer Korea to secure additional of 30 million vaccine doses. And we also will make sure that we will be securing enough doses of the vaccines for 50 million people going forward. And we are going to secure 50 million more doses of the mRNA vaccines. And as part of this aim, we have signed the contract with the Pfizer to secure 30 million going forward. And starting from the first Q of 2022, we will be providing these vaccine doses. And we will also have the option of increasing our contract supply going forward. And going forward, we will also review in detail any of the more doses that are needed as well. And also, we have signed with the Pfizer right now, and we have a total of 17 million doses that have been supplied here in the country from Pfizer. And as for Janssen vaccines provided by the U.S. government, we have scheduled 400,000 doses to arrive during the weekend. And these doses will be arriving in Korea on the 15th in Incheon International Airport after departing U.S. on the 17th. And these Janssen doses will be used, is also in part of a cooperation between the two allies in order to promote public health and to tackle COVID-19. And until now, the two governments have carried out working-level talks, and all of these doses have the expiration date to about mid-December or mid-September. And as for about 300,000 doses, they have used the emergent company's substances, and they have been passed by the FDA of the U.S., and we have confirmed that they have adequate recognition of the food and drug safety, and they will also have the approval here in South Korea by the Ministry of Food and Drug Safety, and will be utilized for vaccine rollout. And the Janssen vaccines has been approved here in South Korea in April, and this is a single-dose vaccine, and this is one of the benefits that it has. And we will be providing these vaccines to the local autonomous vaccine program going forward. And as for these 400,000 doses that will arrive, and also about 100 million additional doses that have been signed with the company, we will be providing these doses aimed at senior citizens. Moreover, we will make sure that they are provided to the residents, or also the people who are at the correctional facilities and residents at the nursing hospitals and flight attendants, and they will be provided to these people starting from 23rd of August. And we will also make sure that we fully utilize the benefits and the incentives of the Janssen vaccines, and we will make sure that they are distributed to the local governments as part of the local autonomous vaccine rollout program. And we will be providing these vaccines to those over the age of 30, and we will also provide these doses of the vaccines to people who have a lot of physical contact with other people, and also who need to leave the company on businesses. And also we will make sure that these doses are fully inoculated to the public starting from 23rd of August. And also we have some updates on the second dose jabs rollout for the senior citizens. And in the month of May and June, we have also senior citizens above the age of 60, and about 8.2 million of them are subject to the second dose, which began yesterday. And in particular, as for this age group between 60 and 74, we have also rolled out these vaccines to about 50,000 people, and also we have about 90% of them receiving the first dose, and also we expect to have the high second dose jab vaccination rate for these people as well. And in order to fully protect yourself against the highly transmissible Delta variant, it is very important that you get both shots. So we ask you to get the second shot as for the senior citizens, and we believe that it is a measure to protect your own health and also that of your loved ones as well. So please get the second dose as scheduled. Moreover, if you have not yet been vaccinated, or if you have not yet made your reservations, as for these seniors, we are also opening the reservation for the vaccines, so please take use of that. Until the 18th of August, that is, we will be receiving the bookings, and please also get your shots as soon as possible. Moreover, we believe that vaccinating yourself is very important. However, it is more important to monitor your conditions after inoculation. As for seniors, if you experience fever or any other symptoms, please make sure that you are not left alone after getting the inoculation. So please take care of your loved ones if you if you are living with your senior citizens. And also we will have the further utilization of the surplus vaccines, and also starting from next week, as for those who have already made the COVID-19 reservations, you could also sign up for the surplus vaccines, and we will also cancel automatically the previous reservation that you have made earlier if you sign up for a surplus vaccine. So starting from next week, Monday, you could utilize this through the social media, and we ask you to also sign up for the surplus vaccines if you have access to them. And as for the hospitals, please have a registry of the list of people who are signing up for the surplus vaccines, and please make sure that they are subject to these vaccines even though they have made their reservations before that. And we ask you to also cancel manually your previous reservation if you have if you are going to register and to apply for the surplus vaccines. And we will also prioritize the surplus vaccines to those people over the age of 50 and also those with chronic illnesses. And also starting from the 13th of August, we will also provide the AstraZeneca vaccines to those who are willing to get these shots and who are over the age of 30. So as for those people aged over the age of 30, if you are willing to get these vaccines, you can also sign up for these vaccines. Right now, our suggestion and recommendation of the age group is 50 for AstraZeneca vaccines. However, considering the supply of the vaccines, we are going to ease the age restrictions just like the Janssen vaccines, and we will make sure that we provide the opportunity for vaccination for these group of people if they want to sign up for the vaccines. And as for those above the age of 50, as for if you are under the age of 50, that is, if you got the AstraZeneca for the first shot, you can get the second shot as Pfizer. However, you also have the freedom to choose AstraZeneca as the second shot as well. And we are also having the 8-week interval, dosing interval. However, you could also shorten that if you need to sign up for these vaccines. And we need to also make sure that the eligible recipient needs to be fully aware of any side effects, possible side effects, that is, and also the age recommendation that we have here in South Korea. And so we ask the hospitals to provide these notifications to the eligible recipients as well. And as for the 13th, we also have been receiving the booking for the COVID-19 vaccines. And out of some 4 million people, we have about 64% of the people signing up for the COVID-19 vaccine.
몇 가지 당부 말씀을 드리겠습니다.
We have some further details for the public, including South Korea. On a global level, the Delta variant is spreading at a very fast pace. Vaccination is very high. Vaccination rate is very high in US, UK, and Israel. However, they are also grappling with an increase in the number of cases. Delta variant is very transmissible, highly transmissible, and also it spreads very fast, and it also increases the rate of hospitalization and also deaths. And compared to other mutations that we have witnessed before, this Delta variant is even more difficult for us to control. However, we believe that continuously, if we have continuously over 2,000 cases on a daily basis here in South Korea, we believe that this will have a heavy toll on the medical response capacity here in South Korea that will affect other patients with other illnesses. And we believe that the Delta variant, one person can spread the virus to about 5 people. And also it is very highly transmissible at initial stages, meaning that you will be infecting others without even noticing the fact that you are doing so. And we believe that there are many silent spreaders within our local community. And we believe that the public people-to-people contact is very risky, and also it increases the risks of infection, and especially taking this effect during the Liberation Day holiday. If we have continued spread of the Delta variant, we believe that we could also see further rise in the number of daily cases. So during the weekend, we ask you to refrain from going outdoors and going to traveling. However, stay home with your immediate family members, safe and sound, and please wear your face mask at all times. And please get tested with the COVID-19 test when returning from your summer vacation. We want to thank the medical professionals once again. We will make sure to exert our full efforts. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간.
Right, that was Cheong Young with Friday's afternoon briefing, and I have Soa back at the desk with the gist of her address. Right, Soa?
Right, Sunny. Let's begin with some prospects for vaccine supply next year, as Korea has signed a contract with Pfizer for 2022. So for now, that's 30 million doses plus an optional 30 million doses, and it is part of the government's plan to roll out some 50 million doses of mRNA vaccines next year. And regarding the 400,000 doses of Janssen vaccines, Chong said that they are to arrive on Sunday, and who will be subject to those vaccinations. She said people that are at high risk of getting infected, as well as people who have difficulties in receiving 2 shots, because Janssen only needs 1 dose for full vaccination, and that will be done through the autonomous vaccinations by local governments. And a note on surplus vaccines, even people who have already made their registration for their vaccination can apply for surplus vaccines, she said, as their earlier booking will be automatically cancelled if they get a surplus vaccine. And also, last but not least, she asked for vigilance for the 3-day holiday Liberation Day season to the nation's people.
Right, which is why I'll see you on Tuesday.
That's correct.
All right, so thank you for that.
Thank you.
global health body has raised alarm over the growing number of reported symptoms of long COVID, and in our studio session today, we delve into some of these conditions. For more, I have Professor KimMoonKyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And joining the session virtually is Professor RayazMalik at Cornell University. Pleasure to have you with us, Professor Malik.
Good morning.
I also have Professor EmadIbrahim at the University of Miami live on the line. Good to have you with us, Professor Ibrahim.
Thank you for having me.
Right, we'll start here in the studio then. Professor Kim, early this month, the WHO said it was deeply concerned about long COVID. Let's begin with the gravity of this stance.
Well, this long COVID is also called post-COVID conditions, and it's quite not uncommon and have consequences. I would say there are three major symptoms, which is shortness of breath and cognitive dysfunction, which we also call brain fog, and fatigue. Totally, there are more than 200 symptoms, and it's chest pain, trouble speaking, and depression, fever, muscle pain, loss of smell, loss of taste. And the duration is not still clear, but we think it's about 3 to 6 months, and some say it's even more, and we need more study. We don't know the exact incidence yet, but in the UK study, they say 1 out of 7 COVID patients might have a long COVID symptom. So who gets this long COVID? There's a recent article from Nature Medicine, including more than 4,000 patients, and they say the risk factor is a obese person, female, and more than 5 symptoms in the first week of illness. And there are other studies that if you have underlying asthma, you might have this kind of trouble. And variants might have a different picture also, so we don't know about which one might have more long COVID. Treatment, it's a multidisciplinary care, which includes primary care providers, rehab personnel, social workers, and psychosocial workers, and mental health professionals. There's no specific treatment yet, and it's because we don't know the reason yet. And there's another question about the vaccination, whether the vaccination might cause the same problem. I mean, we don't know the answer yet, but it is clear that we have more benefits out of vaccine compared to the problem we have.
I see. Professor Ibrahim, what are your thoughts then on the attention currently being directed on the post-infection conditions of COVID-19?
It's an important issue, and we've been looking for that purpose because from the beginning of the pandemic, and we didn't really know if it's going to be a long effects or no. And we particularly were concerned about the fertility issues, and at the same time also the sexual dysfunction in males. And we really found, we ran some studies, and we have some interesting results out of that. They are still early in the phases, but we've seen some long-term effects when it comes to fertility and when it comes to erectile dysfunction as well.
Right, and we'll get into that later on, of course. Professor Malik, there have been over 200 million COVID-19 infections worldwide thus far. Do we have a tangible estimate then on the number of people suffering from long COVID?
So I think there are probably 2 studies worthy of quoting, and both seem to show that 1 in 5 people who have had COVID will develop some degree of symptoms. Of course, it varies, the severity, but nevertheless, I think if you remember, 1 in 5 individuals may develop long COVID.
I see. How does this number then, the number that I mentioned earlier, about 200 reported cases of long COVID symptoms, how does that number compare to that of other diseases?
Well, if you have a severe disease, you might have a long-term sequences, but I would like to mention SARS and MERS because after the SARS outbreak in 2012, there were some similar reports after that outbreak, and usually the symptom remained more than 6 months, and they have reduced lung function and intolerance to exercise, and also they had some mental problems such as stress, anxiety, and depression. and the quality of life was worse even after 6 months. There was a study from Hong Kong about the cases after SARS. They had physical recovery within a year, but the mental health did not recover, and they might combine with chronic fatigue. And there's another study from Canada about the SARS patients. They showed almost similar symptoms, but they also included sleep disturbances. So I would say the recent coronavirus outbreak has some common phenomenon. So the outbreak of the previous two were not as serious as this one. So I think right now it's becoming a big issue worldwide, but this coronavirus has some characteristics like this.
Right, so there are more questions than answers there. Sure. Professor Malik, now I understand you pioneered an eye examination that can be used to confirm suspected cases of long COVID. Please tell us about this technique, including how it began, what you found, and the implications.
Sure, yeah. So, in short, this is an examination which is very quick, can be done in optometry or ophthalmology practices, and it's a technique called corneal confocal microscopy. So this is like a camera which actually takes pictures of the front of the eye and allows us to assess two things. One, underlying nerve damage, which we found in patients in our study in 40 subjects who actually, importantly, had very mild, I would say, initial COVID. And yet, they had significant nerve damage. So that already tells me that the underlying defect that we're looking for, apart from these 200 symptoms, could be this underlying nerve damage in a significant proportion of patients. The other thing we found is evidence of immune activation, which was beyond 12 weeks. So the patients we studied, this is a study in Konya, we assessed at around 3.5 months after their initial COVID infection. And what we showed is that those patients, specifically who had very much, as our colleague said, the brain fog, the cognitive dysfunction, and particularly neurological symptoms and musculoskeletal symptoms, had a loss of nerve fibers in the cornea. But I think it's really important. The message here is that the corneal nerve loss is reflecting generalized nerve loss in other parts of the body. So, and I think that's the key. We're not just showing that this is a damage that is found in the cornea. This is actually reflecting, and this is not just our studies, but studies from over 400 published studies that have shown that this same technique can detect nerve damage in a number of peripheral neuropathies and a number of central neurodegenerative diseases, including dementia, Parkinson's disease, multiple sclerosis. So this is actually reflecting a generalized nerve loss and immune activation. And interestingly, Dr. Ibrahim's statement about erectile dysfunction, we've actually shown that corneal nerve loss is, in 3 separate papers, is very much related to erectile dysfunction. So we're kind of finding the underlying basis, perhaps, of what the observations that Dr. Ibrahim is making.
I see. And just to confirm, Professor Malik, what your study found was that despite the fact that a patient may have suffered a mild case of COVID-19, he or she is still exposed to, still vulnerable to this nerve damage as a post-infection syndrome.
Very much so. I mean, of the 40 subjects, there were only 6 who actually required oxygen therapy, and only 3 of those required actually small period of time on ITU. So the majority of people had not even required hospital admission. And yet, 3.5 months later, when you assess them using the NICE questionnaire, which we use, which is these 29 symptoms, we found that those people who had neurological symptoms clearly had this loss of nerve fibers and increased immune cells.
I see. And now, Professor Ibrahim, then, we're going to go to your pilot study. You are part of a pilot study that appears to show a link between post-COVID-19 and potential male infertility. Can you tell us more about your findings?
Yes, of course. It was a crucial study for us because we wanted to know really the effects, and that was early when the epidemic started. So what we really did was we had like mail-in kits sent to patients that tested positive within various times post the infection. And we compared the sperm parameters of what we had to the actual controls that were COVID negative and age matched. And interestingly, we found that within 3 to 6 months, there was a huge drop comparable to the controls based on the WHO criteria. So the numbers of sperm that we found was a lot less than the normal guidelines. And that was within 3 to 6 months. We were able to get, because of the nature of the epidemic at that time, we were able to get 5 patients to follow up. And the good news is they recovered back after 6 months. So after 6 months, we've seen recovery. But remember, these are still small studies and long-term effects needs to be managed. And we're trying to do that now to see the effects that would be on long-term terms. Now we can get into the 9-month and 1 year post-injury and longer.
Right. So, Professor Ibrahim, what your study found was that the conditions were reversible then after a while.
Yes, and the small cohort that we had, after 6 months, it was recoverable. But we cannot generalize that. Or we always say that we need longer term studies and bigger sample size.
Of course. Right then, Professor Kim, so we've addressed the issue of long COVID within adults. What can you tell us about long COVID within children then?
Post-COVID conditions have a variety of symptoms, and actually we don't know clearly how it's going to show up in children. And sometimes children might not even recognize this as a problem. So it's very hard to deal with in this case. And that is the reason why many people are thinking about vaccination for children, even younger teenagers. And before we start vaccination, we have to make a question. What is the reason we do the vaccination? Do we have more benefits or is it harmful? We don't have a clear conclusion yet, but since the school's going to open in September, and we are very concerned about that might aggravate this outbreak. It is known that in UK there are about 30,000 long-term COVID children, and there's a German data showing that about 2% of COVID children might have a long COVID, and also it might be underestimated, it might rise up to 4%. So it's very hard to make diagnosis, and it's very hard to deal with. Children are in rapid growth, and they are in development stage. And we don't know about the consequences. They might be immense. So I think we need a close monitor about every children who survived COVID-19.
Right. Professor Ibrahim, keeping in mind the adage that prevention is better than cure, do you suppose your findings on long COVID better highlight the importance of inoculation?
Oh, absolutely. And we had a study that was published in JAMA very recently about the effects of vaccination, COVID vaccination, in regards to sperm parameters. And the good news is it really did not affect at all. So everybody in the study, their sperm quality and the sperm numbers did not drop. And we even had intentionally, we had some of the samples in the study, some of the subjects had a starting lower count, and none of them dropped than the actual numbers that they had. Actually, some of them improved, and one of them did continue to be dropped, but never lost any sperm production. So sperm production was maintained. And that was a question that we had all the time. People who are vaccine hesitant and they don't want to take the vaccine because it might affect the fertility potentials. And I get the questions all the time from my patients and even from my family members and their friends. And we proved that that is not. But we have to bear in mind that the study also had some limitations because of the sample size. And at the same time, we also studied the two common vaccines here in the United States, which is the mRNA vaccines, the Pfizer and the Moderna. We didn't go into the other vaccines that are available in other parts of the world.
I see. Meanwhile, Professor Malik, what can you tell us about the medical assistance available to patients of long COVID where you are?
So actually, as part of in the UK, where I currently am, the NHS have actually set up multiple clinics, long COVID clinics, to deal with this problem in terms of trying to recognize it simply from the symptoms. But I believe this is where studies like ours will be very, very useful going forward, because we now have, I believe, an objective test to try to filter out really patients who have got long COVID compared to those who perhaps have got other things going on that people, physicians need to attend to. I think managing, treating the symptoms of long COVID at the moment are very much symptomatic treatments. So if somebody feels breathless, you end up giving them oxygen. If somebody has, I don't know, chest pains, you give them therapies that are not really tested. And that is because we really don't know what the underlying defect is. And I think that's where our study and other studies that are ongoing will be very instructive, in that if we are finding that there is underlying nerve damage, then we need to look forward towards developing therapies which will perhaps help to repair these nerves. Or, as we have shown that there is immune activation, perhaps we need to think about new therapies that may reduce or dampen down this immune activation in order to help. But clearly, I think the important step now is that we have a technique which has an objective way of diagnosing something that's going on, as opposed to kind of a pretty nebulous, 200 symptoms. What do you do? In a clinic? Can you actually go through all those? Whereas we believe that we've got, a test. And so from that, therapies will emerge.
Hopefully. Professor Kim, does Korea have a medical infrastructure set up, that is, to treat people suffering from long COVID?
I would like to know how much the instance in Korea. We have to know that first, and there should be a consensus about making diagnostic criteria and the treatment. And I would like that there is a national monitoring system which includes all cases of long COVID, and they follow up enough period of time. And as I mentioned, we need a multidisciplinary approach. That means it should include doctors, nurses, rehabilitation professionals, social workers, and etc. So if we can include all of these professions, I think we can deal with this long COVID problem.
Right. Professor Malik, speaking within your capacity as an influential scholar in the study of diabetes, that is, are people suffering from this disorder more likely to suffer from serious complications if infected with COVID-19?
In a simple answer, yes, particularly those people who have already got complications, particularly some of the long-term microvascular complications. So there are emerging data that show if you have particularly, say, diabetic neuropathy, which is my particular area of interest, then you are more likely to suffer long COVID. And that kind of makes sense, because if you already have a condition which has a neurological hit, then long COVID COVID comes along, and then you're more likely to get this. But it's also true actually for people who've got, for example, who've had retinopathy or microalbuminuria, and of course people with heart disease, we know, which is more prevalent in people with diabetes, don't do well even in the acute state. So even if they recover, and we know that people who have more severe disease are more likely to get long COVID.
I see. All right, Professor Malik over in the UK, thank you very much for your insights. Professor Ibrahim over in the US, thank you for being with us today and for your thoughts, of course.
My pleasure.
And Professor Kim here in the studio, as always, thank you for being with us.
Thank you so much.
Right, now ahead of the long weekend to mark the National Liberation Day on Sunday here in the country, there is an ongoing campaign that we hope you'll partake in. It's a stay-at-home initiative to better contain the recent surge in COVID-19 cases in the country. See you on Tuesday.